Folks, thanks for coming on the line with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so working through Medicare Basics, looking at some of the fundamentals of the program and the options that people have to complete their coverage, taking care of the gaps and the additional coverages that are necessary in order to have a comprehensive health program. Part of what we'll do today as well is help you with resources that give you the opportunity to look at additional selling circumstances, one, by making you comfortable with the system and its workings, but also leading you to different sources to give you informational seminar material that you can conduct on your own as well. These are opportunities for you to go into the community and do live trainings for informational meetings for the general public. These are approved presentations taken from a multitude of sources, and we'll go through that in a little bit as well. But it's a grand opportunity for you to not only feel comfortable with a sales track in a manner of speaking to follow on an informational basis, but it's a great way for you to make certain that you have your ducks in a row and have the blocking and tackling detail that you need in order to be effective in the Medicare space. Today's webinar is being recorded, and it, along with a ton of the information that we're going to reference, will be sent to you in a follow-up presentation email. So you will have that and all of the information, including a link to today's presentation, a PDF of today's presentation, and that reference material I've referenced multiple times already today. What we'll do as well is make certain that you have a bit of background about Premier Marketing. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, acting as an insurance wholesaler, offering insurance services, working through independent insurance agents. Those contracts are generally vested. They're at the highest possible commission levels available, and recruiting contracts are available for those who qualify. I mentioned that we were founded in 1968. That means that this past year we celebrated our 50th anniversary, and it's a really great accomplishment for a small family agency to grow into one of the largest marketing organizations of its type in the country. We're the largest producer, hand in hand with the agents with whom we contract, for multiple insurance carriers in the Medicare Advantage world. And part of that is due to the fact that we have coverage throughout the country. We're available in all 50 states, and that's a full platform of insurance that's available, insurance programs that are available for you to contract with us, including a full Medicare program, including Medicare Advantage and Medicare Supplement plans, and standalone PDP programs, a life insurance and annuity portfolio that includes final expense life insurance and pre-need programs. We offer long-term and short-term care programs, disability income plans, and ancillary benefits, including dental, vision, hearing benefits, critical illness and cancer programs, and hospital indemnity plans. Crucial pieces that help cover some of the gaps that a Medicare beneficiary sees as they access care. That Medicare Advantage portfolio includes all the big boys and a number of the powerful regional carriers that are a difference maker to you in your market. And that includes the same sort of philosophy when we look at the standalone Part D plans as well. That Medicare Supplement portfolio is very large and encompassing for you. And as we go through and we discuss the different options that people have, you'll see where this number of carriers is very beneficial to you, because it gives you the opportunity to offer options to the folks that you visit with, and options for yourself to have the most competitive carriers in your portfolio as you visit with the Medicare population. That ancillary portfolio gives you an opportunity to help your prospects and clients with coverage that, well, it needs to be there for the Medicare beneficiary, because there are obviously gaps in that coverage. So that's one of the reasons we stake part of our reputation on this ancillary portfolio. So when we look at the Medicare Basics, one of the things that we see is an evolving program. And when we look at the history of Medicare, you'll see that, well, it requires us to be very comfortable with the knowledge base that we have when visiting with people about the program. I subscribe to a daily email called Daily Stoic. And one of the neat things about it is today's presentation spoke to us of the fact that we need to be prepared for what we do. And having the information available for us is a key portion of that preparation, because I've been in the Medicare field for 30 plus years, and I've got to tell you, anytime you think you have all the answers is the time that you realize that you don't. And so having an opportunity to go get those answers is what makes us the difference, and it helps with our peace of mind and making certain that we are prepared to visit with the population that we depend upon for our living. When LBJ signed into law the legislation that created Medicare in 1965, we've seen a lot of changes since then, and you have an opportunity to have that information in your hand as well, because this is one of the reference materials that we're going to send you. Do you need this information to discuss the Medicare coverages that are available to people? No. Some people, however, feel more comfortable if they are up to date with the background that comes as part of the program, so we do that. Boy, this slide looks like a whole bunch of chicken scratching. How do you understand that? It's basically shock and awe, because it's telling us a bit of history about Medicare, because most people, when they visit with an agent about different Medicare programs, a lot of them don't know exactly what Medicare covers, and it requires translation for them. And that is the purpose of our webinar today, is to give you that information to help with that translator service. So when you look at an overview of Medicare, it's important to note that Medicare, in many people's mind, is a health program for folks over the age of 65. And that is, for the most part, very, very true. But about 1/6 to 1/7 of the population is actually under the age of 65 and are receiving Social Security disability insurance and are qualified for Medicare based on those disabilities. There are a couple of illnesses that actually allow a person to access the coverage immediately, with ESRD or Lou Gehrig's disease. That allows a person to get that coverage without the typical 2-year waiting period that others with other conditions have to deal with. It's interesting to look at the different characteristics of the people who are on Medicare, and it helps us understand why we need a full portfolio of products to address the needs of the people with whom we visit. We look at Medicare overall. The median income of a Medicare beneficiary is $26,200. So some of the choices that they have to make to access additional care may be driven by their wallet. As we can look at this particular slide given to us by the Kaiser Family Foundation, which is the basis of a lot of the information that we have today in today's presentation, we also see a population that has a number of chronic conditions. As we age, obviously our bodies tell us that, oh, I got some challenges now. And we see that 22% of the population of folks on Medicare have 5+ chronic conditions. 2/3 of the Medicare population have 3+. So it is an interesting scenario where they have a great need for additional services and a great need for our help in determining what those services might be best covered by. When we look at the dollars that go into the Medicare program, it's a huge number. But where do those dollars go? Well, $688 billion with a B payments made in 2017, you'll see that a large number of those dollars go to the Medicare Advantage programs. And you think about that, why? Well, they're outsourcing the claims in that particular situation. So the carrier that contracts with Medicare to deliver those services are responsible for the entire claim package. And then you'll look at a big chunk of the dollars then go into hospital inpatient services, because it's a very expensive service that is rendered. You have a big chunk going into prescription drugs, and it's an area of concern moving forward. A large percentage going to physicians, and then additional services that come into play as well. So you've got a lot of factors coming into consideration when you look at where the Medicare dollar goes. When you look at some of the basics of Medicare, we have, as most folks are aware, 4 different parts of Medicare. The Part A coverage basically covers inpatient hospital stays, skilled nursing stays, some home health care visits, and hospice care. This coverage is subject to a deductible, which is $1,364 per benefit period in 2019, and also requires coinsurance for extended inpatient hospital and SNF stays, that skilled nursing facility stay. When you look at that, you realize that that is $1,364 per benefit period, not per year. So if a person with just Medicare went into the hospital multiple times, depending upon when they went in, they could pay that $1,364 multiple times in a single year. It's a pretty powerful incentive for someone to look at additional coverage. The Part B coverage covers physician visits, outpatient services, preventative services, and some home health care visits. These are also subject to a deductible, $185 in 2019, and typically a coinsurance of 20%. There isn't coinsurance or deductible for the annual wellness visit or for preventative services that are rated A or B by the governmental agency tasked with that. One of the things that we see, though, is if someone goes into the hospital before they've satisfied their Part B deductible, keep in mind, if they don't have any other coverage, they have to satisfy that because they're visiting with a physician in the hospital, and that physician coverage is not all encompassing. When you look at Part C, these are the private programs that a person can enroll in that gives them a different sort of coverage and a different administrator of their coverages. When someone enrolls in a Medicare Advantage plan, they're not giving up Medicare, but they are assigning their benefits to a carrier for administration. This is an increasingly popular option for individuals, and one of the reasons why, well, it's very cost effective on a premium basis, and it many cases incorporates in the Part D coverage, the prescription coverage that folks need as well. When we look at Part D, this covers outpatient prescription drugs. These are plans that are available through private organizations, independent insurance agents, or insurance plans that offer these programs, and it gives the Medicare population a fairly diverse choice when it comes to the programs that are available to them. So as we note on this particular slide, in 2019, beneficiaries had a choice of 27 PDPs and 21 MAPDs on average in their market. You see a lesser selection available in more of the rural areas, but you also have an opportunity for the government to step in and help with some of the expenses that aren't covered for this program, and that is the Extra Help program, the low-income subsidy, that is a very valuable part of our knowledge base in order to assist our prospects and clients to the maximum value that we can make available. You'll note that enrollment in Part D is voluntary, and 43 million people on Medicare were enrolled in one of these programs that offered drug assistance, PDPs or MAPDs. And of this number, roughly 1 in 4 qualified or receives, I should say, low-income subsidies, that Extra Help program. We spoke of that Part C program and the popularity that it is growing with that option, and we can see that, wow, over a third of the Medicare population is enrolled in one of these programs, and it's one of the reasons why we need to be very aware of the options available in our target market and make certain that we have those programs as part of our portfolio if you're looking to specialize in the Medicare arena. There are agents that will choose not to offer these programs because of the contracting and annual certification process, and they choose to deal with the higher income Medicare population. But that is something that you'd have to decide in your marketing program if that is viable for you. Remember, we spoke of the median income of a Medicare beneficiary at $26,200 for an individual. When you look at the premiums of a Medicare supplement plan coupled with the cost of a standalone Part D program, sometimes that exceeds a person's budget when they're on Medicare. So because there are these gaps and in the basic coverage of both the medical and the prescription drug coverage, there are supplemental programs that help cover that difference. And this gives you an idea of where that falls. Once again, Kaiser Family Foundation tells us that about a third of the population on Medicare is covered through group. About a third of the population is covered by Medigap. About 20+% covered by Medicaid, and some other incidental coverages, including a big chunk, nearly 1 in 5, that has no supplemental coverage. Wait a minute, John, didn't you just say 30-some million or a third of the population is on a Medicare Advantage plan? This is the coverages that are noted for the individuals who have stayed on traditional Medicare based on the last available numbers. So the folks that aren't on a Medicare Advantage program, this is where they're getting their extra assistance, either through a program available through a retiree plan or a current employer. The traditional standardized, modernized Medigap programs, extra assistance based on their income and assets through Medicaid, or they choose to self-insure. So a big difference there as to where we need to look at that population in order to help them thoroughly. One of the reasons why Medicare Advantage programs is also very popular is the fact that they help with additional benefits that traditional Medicare doesn't cover. So these include some different things such as dental services, eyeglasses, hearing aids. This past fall, this was a great topic of conversation because the government allowed the Medicare Advantage programs to offer some more non-traditional benefits. And we're going to see a preponderance of that moving forward, in my opinion, but it'll be interesting to see to what extent, because some of the tax that had been alleviated from those programs this past year is coming back in the future, and that doesn't give the Medicare Advantage companies as many dollars to play with for the extra benefits. So it'll be something to take care of and watch as well. If a person is enrolled in traditional Medicare alone with Parts A and B, the numbers that they spend out of their pocket for healthcare spending on average is approaching $6,000 a year. And that's including premiums for the Medicare programs themselves and Medicare Supplement insurance and for the services that are being rendered. And so we can see why this is of major importance to this population, because it hits the pocketbook really, really hard. And this gives us an idea of where some of those dollars are spent. So what we see in a lot of circumstances is people assuming that long-term care is covered by traditional Medicare. And for those of us who are familiar with the benefits on traditional Medicare, we realize that it is not. And it is one of the great needs within the Medicare population is to make certain that they have long-term care coverage, because these programs have been underwritten differently in the time period that they have been offered. We're seeing fewer and fewer carriers offer them on an individual basis. So we're seeing also a look at some shorter term care programs that help with that circumstance. So it's interesting to see where those dollars go out of a person's pocket. When you're looking at such a huge number of the governmental budget, nearly $700 billion, you realize that a big chunk of this is an area that the government really watches, but we also realize that there's a growing population, so the number is going to grow regardless unless services are cut. And no one wants to see that. So this gives you an idea of some of the growth in those dollars and how it's being spent. One of the areas that we mentioned that's of grave concern when you look at the costs that are part of the effect on the overall programs is rising prescription drug costs. And this is an area that not only affects the Medicare population, but the under 65 population as well. When you have new drugs being developed, and when they come out, well, they're name brand, a carrier has the pharmaceutical company has the protections on that program, so they tend to be very expensive in many circumstances. And some of the medications coming out now are even absurdly expensive, where they're hundreds of thousands of dollars per year for different types of conditions in order to address and help cure or moderate that illness. And we can see that this is going to be a driving force in the Medicare world as well. Where does the money come from? Well, a number of different areas. It'll come from general tax revenues, payroll tax contributions, the premiums paid by the beneficiaries, and some other sources as well. So it's an area that is of grave concern because, well, if you look at Part A, it's funded mainly by a payroll tax on earnings from the employers and employees deposited in the hospital insurance trust fund. Higher income individuals pay more into it. This is projected to be solvent, this trust fund, through 2026, 7 years. Part B is covered by general revenues and beneficiary premiums. The standard premium for a Medicare beneficiary is $135.50 per month in 2019. This is higher for higher income individuals as well, and they contribute more than folks under a certain income. The Part C programs is not separately financed, so they come through payroll taxes, general revenue, and premiums as well. And generally, Medicare Advantage enrollees have an average monthly premium of $34 a month. You'll see in many markets that the premium is kept at zero in order to attract interest and enroll people into the programs. The Part D plan is funded by general revenues, beneficiary premiums, and state payments. The average premium in 2018 for a standalone drug plan was $41 a month. It also has an effect based on that low income subsidy that can help with that premium cost based on income and asset thresholds, and we'll get a little more detail on that later. When you look at Medicare on a whole, it's a great topic of interest to the politicians, so we have a bit of a political football, and everybody speaks to the need of making certain that the funds that power Medicare stay solvent, but you also have great talk on Medicare for all. And when you look at the cost of such programs, it'll be interesting to see how that is funded, if it did come to be, but it is a serious consideration moving forward. There are organizations that the government has put into place to help moderate some of the costs, and these include accountable care organizations, and these are groups of providers who accept responsibility for the overall care of a Medicare beneficiary, and they share in the financial savings or losses depending upon their performance. You see these in more urban areas more often than not. There is actually a governmental agency whose purpose is to innovate the payment models and the delivery of the care for the Medicare system. Just an interesting sidelight. When you look at how things are going to progress in the future, something needs to be done. There are more and more people that are going on to Medicare, and there are fewer and fewer people actively contributing through payroll taxes moving forward to help sustain the coverage for the folks on the program. So we're going to see some interesting situations as to how the politicians deal with this. And of course, this is a population that is a voting population, so they are well aware of the fact that these choices make a huge difference in their political future as well. When we look at the overall Medicare market opportunity, we talked about that growing number of individuals who are accessing care through Medicare. And when you visit with different carriers and marketing organizations, we tend to speak of the 10,000 people plus a day who are turning 65 and accessing Medicare. Keep in mind, as we mentioned earlier, that's only a big portion of the folks that access care through Medicare. That 1/6 of the population that are under 65 aren't included in these numbers. So this represents a huge opportunity for folks who are cognizant of the different programs that are available to the Medicare population and make themselves part of the delivery system of that education for people and the choices that they have. When we look at that Medicare population as well, you'll see where they fall and where they get additional assistance. It's interesting to note that it's about 3/4 of the Medicare population that have Part D coverage, and with drugs being a big driver of the medical cost inflation, you've got a good portion of the population that's still self-insuring for that particular piece. When someone becomes available or becomes eligible for Medicare based on age or disability, they have different options that are available. And we speak to those earlier as to how they were funded, but it is part of our obligation to inform our prospects and clients of the different options that they have available. Some agents will speak to one area or another predominantly. I think it behooves us all to have a working knowledge of all of the available options in order to properly serve the population that we visit with. As people age in, we note that it's basically an even split as to how they lean. So if you're looking at that and you don't have a full portfolio of products, you're going to miss out on one portion of it or another. This is information given to us, provided to us by Deft Research. So it's a recent piece, 2018, and we can see that we need options within our portfolio in order to serve the population we're visiting with. That comes with different obligations because there are key differences that we have to have as an agent to prepare for the opportunity, and that includes making certain that we have the knowledge base on the differences between the programs, and that includes not only the benefits, but what it takes to be able to offer them. So the contracting and certification, the marketing and conduct oversight, making certain that we're doing what is proper and just when it comes to the enrollment periods, because the government also lays that on us, and we have to make certain that we are doing things within the realm of compliance to be licensed and certified and appointed in the areas in which we operate. Those enrollment periods, well, they're changing each and every year, it seems like, but a big change this year is the OEP period, which goes on for another 4 days. It's the first 3 months of the year, but people have a bit of a get-out-of-jail-free card with other special election periods as well. So there are things that come into play on an ongoing basis. The OEP period is a replacement of the Medicare Advantage disenrollment period, the MADP, which went away this year, and is an opportunity for folks who are on Medicare Advantage plans to change their coverage. If a person isn't on a Medicare Advantage plan as of the first of the year, this isn't an enrollment period they can use. And if someone is, they can use it just once a year. It doesn't give a person an opportunity to change from one standalone PDP program to another, and it is not an extension of the open enrollment period that we see from October 15th through December 7th. And so a person on original Medicare, this isn't an opportunity for them to pick up an MA plan. This gives you some additional information on those different enrollment periods. And we see that there is a large number of special election periods available to the Medicare population. When you think back to those characteristics and you have a number of those individuals who have chronic conditions, well, based on the availability of certain chronic special needs programs, that may be their opportunity to change coverage to one of those programs throughout the year. Because of the income averages that we see in the Medicare population, the lack of income in many circumstances, and the tight asset situation that many of these individuals have, you have a financial need that gives you an opportunity to change coverage as well. In addition to the big things that happen in life, we move, our circumstances change, and so we see a large percentage of the Medicare population that even though we are in a lock-in period where they are subject to the choice that they made during last fall, it does give them an opportunity to change based on their particular situation. It's also the situation can be a bit confused by the health insurance marketplace as well. So the ACA programs, which there's a recent court ruling that may dissolve that entirely, but folks are confused in many circumstances as to how the two programs work, particularly since they're both administered by the Centers for Medicare and Medicaid Services. We have a program that helps people walk through that differentiation in Medicare in the marketplace. So you have that detail that is necessary to help people in those circumstances. These also give you different Medicare resources to access data and options for the population, so you have them at hand's length. For the folks that are the half of the newly aged in Medicare population that are choosing Medicare supplements, well, there are regulation changes for that as well. Beginning next year, programs that cover the Part B deductible will not be available for newly eligible individuals moving forward. The plans that cover those circumstances, C and F, are still available and will continue to be available to folks that are on Medicare, but they'll be curious to see how the carriers price those programs moving forward and if they'll be a true viable option in the future. Because Medicare Medigap plans are standardized in their benefit structure. This information gives you those details for the different plans with 2019 numbers, with the deductibles and the out-of-pocket expenditure based on the plan choice that a person has with a Medicare Supplement plan. So how do we leverage this market? Well, it's important for us to work as that translator, so we need to have the information that we read and study. We practice what we preach. We target certain populations. We contract appropriately to serve the population in our target market, and we leverage the resources through the organizations with whom we contract, the carriers with whom we contract, and the government and other agencies to make certain that we are properly explaining the options that people have. And so one of the first things that we utilize is our Medicare and You Bible, in a manner of speaking. Everyone who is on Medicare receives a copy of this each October. It is updated each October with new financial details and any changes that are brought about in the Medicare program. You can also access additional Medicare training through the CMS website that gives us options to reach into outreach and education through the Medicare Learning Network. These are actually very, very good presentations when they are delivered on a monthly basis by the folks with CMS. They're actually very informative and not entirely boring. We've had discussions in our office as to, gee, do you want to use that presentation? It's so boring. I think Medicare has made some great strides in making certain that the information we deliver through their programs is both informative, but also doesn't put people to sleep. Some of the different pieces that are available for you when you look at, pardon me, I'm pulling up this particular presentation. This resource guide, one of the things that you'll find when you go on the National Training Program with CMS is some of the documents will appear dated and they aren't always updated in a timely fashion. But this is that document, and it goes through and gives you access to the different assistance provided by the government. It's a really nice piece that enables you to have the information you need when a question is posed that, hey, I don't have the answer for that, I'm going to have to find out. Well, this is a great place to go in order to receive the information or track it down and make certain that you answer the questions that are part of your appointment with the Medicare beneficiaries we visit with. Great way to go through a ton of information they have available, and you can actually sign up and they'll send you updates as well. I got one actually earlier today. It also makes information available on the Medicaid programs, and some folks get very confused as the difference between Medicare and Medicaid. And the programs, since CMS does oversight for the under 65, that's available there as well. And since enrollment in the programs on Medicare are handled through Social Security, how to access that information as well. So this is one of the reference materials that is going to come as part of the follow-up to today's presentation. As I scroll through this presentation, you realize that, wow, if you went through everything, I'd be here all day. Yeah. Well, we want to kind of minimize that as much as possible. But they have then different components that are a nice piece for you to use as a learning tool, training tool for yourself, but they're also presentations that you can use with the general public as well. This particular piece is a great Medicare Basics program, and it has within it links to videos that help explain the coverages as well. So it's a great way for you to use government material with the general population in a format that, boy, it doesn't put you to sleep. It's very informative. It can be very long, 98 slides. Well, gee, John, you got 104 in this presentation. We're going through them pretty fast, though. But it gives you the different detail on all of the coverages, including material that is something you have to check, because this is still 2018 material. Don't worry, we've got the 2019 material as part of the presentation. That's why there's so many slides. So it gives you the opportunity to go through and visit with folks and train yourself on it. It gives you a great source to reach for those frequently asked questions. It goes through the enrollment periods. It speaks to what you can and cannot do on an ongoing basis in your training, education, and marketing activities. So some great pieces that are available to you through the government. This particular presentation is not one of the pieces that will come to you as part of the follow-up, because it's too large for us to kick through most of the servers. I apologize for that. And as we go through and we look at some of these other presentations that are available to you for the community use, you'll realize that it'll take multiple email correspondence in order to get them to you. So I don't want to email everybody everything if they don't want it. And so some of this will be by request in order to make certain that we don't overload your email any more than we need to in order to be effective in delivery of this information. So you can see that it goes through a ton of different material. It's a great way for you to be familiar with the programs that are offered as well. So watch for a link to this and the additional information. This is also a great program for you to use when you speak to people who are just becoming eligible for Medicare. And it's the Getting Started with Medicare presentation. This is smaller than the previous one. It will be part of the follow-up. And what's nice is you'll see that it gives you the talking points on the different slides, so you don't have to have all the answers or read the slides in order to be effective in the delivery of the program. So it's a neat way for you to have basics delivered not only to yourself, a great way for you to become further knowledgeable about the programs that are being offered through the government and the options people have to supplement that coverage, but also a great way to deliver that message to the public as well. There are also different components, different modules that are available for subsets of the information. So if you wanted to do a general Medicare presentation, you have a ton of options there. But if you wanted to do one based on the Medicare Advantage programs, Medicare Supplement programs, the standalone Part D programs, you have that information available for you to run through with the population that you're visiting with, and doing so in a compliant and informative fashion. So you have that for a number of different topics. And you also have that information available from different advocate groups. The Medicare Rights Center has partnered with the National Council on Aging to have their version of the presentation available. We have them available from different medical groups, but you'll also see they're available from different carriers as well. One of the companies that has done a lot of work in making this information available to us is United Healthcare through their Medicare Made Clear series. And you'll see that they make available different PDFs in different sections. When you look at these particular reference materials, they're branded with United Healthcare, but it doesn't address their specific plans. So it's a very strong asset to use. In certain circumstances, I prefer to go with a generic type of approach, but in different areas, this gives you an option to not only use that particular material, but much of it is available to their contracted and certified agents, where you can get hard copy ordered at no additional cost. So it's a great way for you to couple a presentation with not just the presentation itself, but tactile handouts that you can give to your attendees so they're comfortable with your presentation. The guides are really cool. They have a PowerPoint presentation as well, as do a number of other carriers. You'll see that Aetna has a Medicare 101 presentation for you to use. Anthem has a ton of material for you to use. Many of the different Blue Cross Blue Shield subsidiaries will do the same thing as well. Humana will also do a general presentation, but all of the carriers, if they offer a Medicare Advantage program, they tend to make the material available to you and really want you to use their presentation material. And that gives you then the opportunity to visit with that carrier to see what additional support they might be able to provide when it comes to handouts or other marketing efforts in order to make your event successful. It's also very, very important that as we become contracted and certified with different carriers, that we become very familiar with the programs that they're offering through our services. Because, well, one, you got compliance on you, but you also want to make certain that you're properly presenting the programs, and if you are secret shopped, you're doing what you need to do in order to stay within legal bounds, being compliant. So you've got MAPD programs. The different carriers also look at some of the subsets, so the dual market, Humana, Anthem, United Healthcare, OL, Centene, WellCare have these programs that help you become very effective in that area, along with some folks that have material available for you with the chronic special needs programs. Remember, a portion of the characteristics that we saw spoke to 22% of the Medicare population having 6 or more chronic conditions. A different piece that wasn't in the presentation, believe it or not, I didn't stick everything in here. 66% of the Medicare population is 3+. So having information about available chronic special needs programs can make a great opportunity for presentations to do year-round as well, because that does generate a special election period for you. When you look at the material that's out there, should you Google, there's a ton, you'll note that, hey, didn't we go, well, that looks, yeah, it's an old presentation from the National Medicare Training Center, and it is like 9 years old. It's, you know, you put stuff on the net, it stays there forever. So we have to make certain that we have all the detail that is current. So some of the presentations that we've shown a little bit earlier on the current website still has 2018 information in them. They haven't been updated by the government. And boy, we're almost in April, a third of the way through the year. Well, we're a quarter of the way through now. So how do we get that information? It's all available through the governmental agencies. This is the information on the infamous IRMA. So the monthly premium that is based on someone's income. And you'll see that generally the average applies to the majority of the Medicare population, because we're looking at $85,000 a year for an individual, and it's based on taxes 2 years prior. So you have a select number of people that actually pay some of the larger amounts based on income, but as we see a increasing number of individuals who are part of what is referred to as the working aged, the folks over the age of 65 who are still gainfully employed and making money, well, they might see some differences in what they have to pay for their Part B coverage. And that is also something that has to come into play when you look at the married couples as well, because they're subject to different amounts as well. It also gives us an opportunity to visit about the changes in the deductibles and coinsurance that a person has year over year, because each year they creep up, and we see that number rise, and it is one of the things that Medicare supplements are generally gauged with. Okay, we have an automatic COLA to take care of the difference as well, because the Medicare Advantage programs are, the benefits are set by the carrier. They're not really affected by this. It deals with their profit margin and some of the things that come into play, but this is an area that gives us the opportunity to visit year over year, demonstrate our knowledge in the area, and access the information that is available to us. This gives us some information as to how people access Medicare benefits should they not have paid into the Medicare system through Social Security, the minimum requirement in order to be premium free. A ton of the information obviously is available to you through Medicare.gov. Utilizing that Find Health and Drug Plans is a great way for you to access additional comparison information. We actually have a software program I'll visit with very briefly in just a moment that speaks to a comparison tool that you can use as well. And this particular tool gives you access to a quote engine that gives you the Medicare Advantage and predominantly the Medicare Supplement differences through a complimentary service provided by our organization for contracted agents. It then behooves you to look at an individual situation and see what part of that portfolio that you offer covers the needs of the people with whom you visit. So why would you want to do all that through us? Well, part of it is we give you an opportunity to contract simply. You have a number of carriers that you may be looking at. Creating an agent profile, Insurance Bay, gives you the opportunity to contract with multiple carriers on a electronic basis, making it much quicker and simpler in the long run. We also give you the opportunity to cover yourself with errors and admissions coverage at a discounted rate, regardless of who you contract through. As an independent insurance agent, you may work with multiple marketing organizations. This gives you the opportunity to make certain that you aren't part of a blanket E&O policy that only covers certain carriers. This makes certain that you have that roof over your head, in a manner of speaking, as well. We also help you maintain your insurance license through discounted continuing education bundles through WebCE. As an independent agent, you are responsible also for your own benefit package. This is a way for you to get non-cancelable disability income coverage through our organization at discounted rates, where you share in the commission of the policy as well. And it is designed to make it very simple for you to obtain this coverage. We do a ton of presentations that help you not only learn more about different programs, including Medicare and Medicaid, low-income subsidy and Medicare savings programs, the different things that affect the Medicare population, but we also do different informational deliveries of marketing opportunities. Believe it or not, for those of you that have been in this arena for a while, Walmart's sending out their list lickety-split next week. We have a webinar on retail marketing in a couple of weeks. We have different paths that are designed to help you approach a target market and working your community, in dealing with faith-based organizations, in working with different providers, including Medicare Advantage network providers, but also other professionals that deliver upon the services that are covered by the plans that we offer. We also offer electronic support, those quote engines that I visited with you about just a moment ago, but also remote enrollment programs that give you the opportunity to maximize the time that you have and properly address the needs of our prospects and clients. We also have a program that sets up to help you market through social media. A great way to automate that system and make it simple for you to use. A ton of people on Facebook and everything else, and it's a great way to use those mediums to reach out to the population we visit. Part of how we maximize the return on your investment of your time and contracts with our organization is make certain that you're aware of all the incentives offered by the different carriers, including financial considerations and trips that they offer. But we also offer our own producers convention this year. We're going to Jamaica. We're about to announce the 2020 trip as well. So it's an important part of an overall consideration of contracting and where the business goes. One of the caveats I need to lay out there, well, Medicare Advantage and prescription drug programs, the commissions on that are set by the government, and it doesn't allow us to take into account that production for qualification for these incentive trips with our agency. Some of the things that we do to provide an opportunity to visit with people is the different lead programs that are available for you. There are certain programs that still allow you to utilize Ma Bell and cold calling. We can provide custom lists for you to do that. Obviously, you can't do that with Medicare Advantage or prescription drug plans. You can for the vast majority of the Medicare Supplement plans. We also help you with sales tracks and programs to market through your community, as I alluded a bit earlier. Some of the carriers also generate prospects for us to visit with and have different marketing support programs on their own. We want to make certain that we utilize all the resources available at our disposal in order to do that, and that includes internet leads and support for your direct mail programs, and we help subsidize that cost for direct mail programs through production with our organization through the carriers that we offer. So a long presentation. I apologize. You're going to see a ton of material come to you as reference material for you to use, but we want to earn your business and we want that opportunity to work with you. And so as we go through and we look at the different possibilities available for you to offer your prospects and clients, I urge you to carefully consider our portfolio. We can get contracting information to you so you have everything in writing ahead of time and you know what your compensation and the expectations are moving forward. That said, it's now in your court. The old expression, when all is said and done, more is said than done. Well, if you've seen different pieces of today's presentation that might be valuable for you for your insurance practice, let's look at what it takes to kick it in gear and move forward. You can reach any of the marketers at Premier Marketing through our toll-free number at 1-800-365-8208. And you can also access information through our website, including contact with any of the marketers through premiersmi.com. We look forward to the opportunity to visit with you. We want to make certain that we do everything we can to accommodate you and your business and do so in a timely fashion. That said, I want to thank you for the investment of your time today. We look forward to those conversations in the near future. And in the meantime, we wish you good selling. Thanks so much. We'll talk to you soon. And questions will be answered as part of the follow-up that is sent to you after today's presentation. Thanks so much. Talk to you soon.